Hello, I'm Gloria Averbush of Chalk It Up, an informative and thought-provoking look at a variety of contemporary topics and issues. Our guest today is dermatologist Dr. Terrence Keaney, a co-founder of Skin DC, a practice located outside of Washington, D.C. Dr. Keaney, you've made an interesting point about the way our skin is looked at. We're used to having a dermatologist just use the naked eye. What is your more scientific approach?
Yeah, as the dermatology field has grown and research has expanded, we understand that the skin is more than the few layers on the top. There's deep layers that contribute to skin disease. So the imaging technology that dermatologists can utilize to examine different dermatologic diseases, I think, are critical as we continue to grow within a specialty. So in my practice at Skin DC, we use a variety of different imaging technologies to look at skin, to better diagnose and provide a prognosis and treatment plan for our patients. What are some of those things that we do? We can look at moles to help identify early melanomas by using high magnification, almost like magnifiers against the skin that can magnify the skin to 40, 100x, so we can see the actual pigment pattern to determine if it's a melanoma, for example. For hair loss or hair disease, we can use, once again, high magnification imaging to look at individual hair follicles to determine, are they miniaturizing? Is there an inflammatory process destroying the hair that contributes to hair loss?
Let me ask you a question as a follow-up. Is this relevant to just a subset of patients, or you would say that everyone, for whatever possibility, this could be applied?
So this imaging that I talked about, the skin, we call it dermoscopy. You can apply that not just to pigmented lesions to rule out melanoma, you can look at rashes. So these imaging technologies have really a broad array of applications, and in our hands, in our practice, we do it on every single patient. Because we can use these to diagnose early dermatologic disease. Because I always say to my patients, prevention is easier than correction. So if we can find out early dermatologic disease, we can provide an intervention that could potentially cure or get rid of that problem before it becomes a bigger one that makes it harder for us.
And in your experience, the results of this early detection have stood for themselves as proof that this is the right way to go. It's made a difference.
Absolutely. It's worth our investment. It is an investment in our practice of both the capital to buy this equipment and also the staff to take the time. We take a little bit more time with our patients because we have to take all these detailed imaging. So not everyone necessarily wants to invest in it, but I think the outcomes we can get from investing in this technology, this imaging, is worth the capital and time investment in our practice.
Thank you very much for an interesting look at a new technology in dermatology.